So we've talked a lot about the animal systems where we might have co-infections, and some of the students, not surprisingly, wanted to know if there are examples of co-infections in humans. So I'm going to turn that to everybody and how they change the epidemiology of human infections. So,
gosh.
I think there's a really nice example that occurred maybe 2 years ago now on some of the upper respiratory tract infections. So some of these, many of them are caused by viruses, and we get a diagnosis, an etiological diagnosis. This is the causative agent in about 40% of these infections. And so when we actually start looking, we find that there can be multiple agents involved. And so a couple of years ago, there was an outbreak of what seemed to be a normal respiratory pathogen. It's respiratory syncytia virus, but it was more severe and in a different age group. And in fact, it was a co-infection with another respiratory tract virus called metapneumovirus.
So I'm going to propose that nearly all diseases are polymicrobial in some ways. So certainly every infection of the lung involves more than one simple infection because you have the other bacteria present as well. I mean, we had a discussion about the microbiome last week, and you know, in some ways you can think about that as one. But one of the nice examples I like is some of the work that's been done on HIV and worms, where they've shown that people who are infected with HIV are more likely to be able to pass on. No, I've got it the wrong way around. The people who actually have HIV and worms, they're more likely to transmit HIV, which is important.
Yeah.
And the interesting thing is that if you just treat them with an anthelmintic, which just costs a few cents, then this can have a big impact.
It's still very controversial. The HIV worms, it's not really clear.
Nice story.
Because, yeah, sounds really good.
A less controversial example of that, though, is that the worms that, at least the gastrointestinal worms that chew up the gut and start causing anemia, so the bleeding, so that affects malaria. And so the malaria is less severe in people who have these very nasty worms. So you can actually make the malaria worse by using the drugs against the gastrointestinal worms.
I think in humans as well, the HIV tuberculosis co-infection, if you want to tip the balance in the bad direction, and that is that, you know, so many people have TB, mycobacterium infections. They don't have tuberculosis, the disease. But in the presence of HIV, the number of individuals who actually are carrying the mycobacterium, the disease manifestations are much worse. And of course, that makes a lot of sense if the infection is being controlled by immune surveillance, and HIV takes that immune surveillance out.
So we may have talked before about how could we use one infection to help control another infection. So we have issues with anthelmintic resistance in worms. We have issues with antibiotic resistance.
We talked about syphilis before.
Yeah, and we talked about syphilis and malaria, that they actually use malaria to cause a fever that could then solve issues with syphilis. So could we use infections as the answer to some of our issues?
Well, I think there's not going to be too much enthusiasm for introducing new infections. But I think in the case of, for instance, with the worms, if we could figure out how worms were immunosuppressing, they would have merits if we could do it without the worm, if we could use the sort of trickery that they do. How do you direct the immune system in one direction or the other?
Yeah.
Trying to figure that out from first principles and doing it without the new bug would be very good.
So you could actually have a robotic worm.
Yeah, or I was thinking of some sort of compound with drugs.
Robot worms are good.
This may be a little bit tangential, but I was just reading the forum right before here, and there were interesting questions about oncolytic viruses. Obviously, now the cancer is regularly not a transmissible disease, but it is the interesting possibility that one might be able to use viruses to target cancerous cells. And
in fact, they are being used. And again, the principles, coming back to first principles here, I asked this to a virology class one time, and some of the students actually figured this out, that if you have viruses that can only replicate in rapidly replicating cells, okay, then it makes sense that if you can get that virus into a tumor, which are by definition rapidly replicating and expanding, that you should be able to have some effect. And so some of the adenoviruses, you had to alter them a little bit so that they don't do many things bad, have been considered as targets. There's other viruses that if you strip down some of the bad parts, you can actually get them to lyse tumor cells.
So I do think there are, so going back to the general question, I do think there are a number of infections which are probably polymicrobial co-infections that we're not thinking about. So I'm thinking about Lyme disease now, where there's huge variation in the symptoms you see in humans. Now, is that because their immunity is different? Is that because their state is different? Or is it because they're receiving secondary infections when the tick bites them? And so they're getting multiple infections at the same time that's interacting with the Borrelia that causes the Lyme disease, that we think causes the Lyme disease. And that's giving us multiple symptoms that's taking place.
I think measles is another interesting case where
Extremely interesting.
It's very
just the best.
for sure. So, but oftentimes, like the severe disease comes after the virus has been clear, and it's secondary bacterial infections that causes
flu.
horrible things.
You don't want to go too far. Flu and bacteria pneumonia. Pretty classical.
I mean, I think many viruses open the door for secondary infections, which wouldn't cause any pathogenesis in healthy individuals, and great studies in immunocompromised individuals, which with full-blown AIDS, they often get killed by fungal infections that are normally not problematic. It tends to be the kind of thing that kills them. Indeed.
HIV
Yeah.
does, absolutely, yeah.